Hi guys, welcome to this week. You're all done with your exams. Yay! We're at about midterms this week. I will be doing midterm reports, recording our lecture tonight so that you guys have one. I'm not going to have it too long. We really talk about education and community tonight again. And so we're going to take a look at our PowerPoints from chapter 11, and we'll see a little bit of chapter 12 as well. I'm going to overlap next week for chapter 12 in our discussion so we can do it something a little more interactive with it. So when we think about community and education, we're going to take a look at what we need to remember when we're dealing with our different types of community-based individuals. So what we're going to look at tonight is we're going to look at ways people learn, think about how does this guide our education as a nurse, what's the importance of literacy, and how do group and members learn about health behaviors, how can nurses work to promote the health, and talk about some strategies. So just to think, know that we provide information to our clients, okay, and we use health education to help promote, maintain, and restore their health. Education is going to allow individuals to make informed health decisions, assume personal responsibility, and cope effectively. We're going to take a quick look at Healthy People 2020 objectives. Our priority areas are unintentional injury. We're going to look at violence, suicide, tobacco use, unintended pregnancies, those kind of things that are going to be our priorities when we look at it, unhealthy dietary patterns. So this is a community-based education program that was developed, Healthy People 2020, and you guys should be familiar with it by now. So it gives objectives, what we're going to look for. And with educating our clients, we're going to take a look and see how that happens as well. So when are going to develop a health education program, the first thing we're going to do is look at a population and look at the learning needs. What do they need to learn? What do they need to figure out? Then we're going to look at our learning theories, we'll talk a little bit about. And then we're going to look at which educational principles are most likely to increase the learning, examine our issues, design and implement the program, and then we're going to evaluate. So we're going to be using our nursing process here. We're going to identify our population first, and then develop our program, and then evaluate then at the end. I want you to know there is a difference between education and learning. Education is an activity that's taken to create effects or changes in the knowledge or base of a group or community, where learning is going to be the process of gaining knowledge and skills. So most definitions of the learning process are going to include measuring changes in behavior that happen over time. When we look at how people learn, we know there's been a shift on how people learn in society. So we know it's gone from a sponge or a vessel approach to more of an active process. So we used to go out there and teach information to our patients, and then we would expect them to spit it back out. Just like we in this class try to do more interactive. I like to have you guys involved in conversation. I like you guys to have feedback. I like you to do group projects together during class so that I know that everybody has different methods of learning. I want you to remember that everybody comes with a different basis, what they know and what they believe. Some cultures are going to emphasize education a lot higher than others. Know what has happened along their way. Was elementary school a real concern? Was there something that happened there that really turned them off to learning and to education? And want to know how well can they understand and relate to information. So if we have a patient who speaks a different language, how able are they to understand? And as a nurse, you need to take a look at it and say, are they understanding, or am I educating them at a higher level than for what they're going to understand? Okay, and so really we need to look at the people that we're teaching to and what their needs are and what they know. So sometimes, a lot of times, you can say to the patient, what is it that you know about whatever the topic is that you're going to discuss? And that starts it off with figuring out what they know and then what they believe in. 3 educational principles we look at is the nature of learning, the educational process, and the skill of effective educators. So these 3 principles are going to really dictate how we are going to teach our patients. So one way we think about how people learn, it's called the nature of learning. And this I would like you to know very well. There's 3 different types. It's called cognitive, affective, and psychomotor. There are 3 different domains of learning. And each domain has a hierarchy and builds on the previous one. So when we look at this, I have a picture here for you. When we look at this, cognitive is going to be our mental skills and knowledge. Affective is going to be, the way I like to remember this is affective is really going to be our feelings, our attitudes, and psychomotor is going to be our physical skills. So if a way to remember this is psychomotor and physical, affective and feeling, and cognitive can go with knowledge. So these are three different domains of thinking. They all work together and they impact each other. Okay. So when you're acting and doing things, what I want you to remember is in our cognitive is where we're going to have Bloom's taxonomy. And that's the different levels of thinking where we start at the base and then we go up in our triangle. I have a little video that I'll have you guys review at the end that goes over the different levels. I've enjoyed the video. It's from Inside Out. And so it uses all the different levels and it helps you understand as the movie's going on, where you see those different levels. All right, we look at the educational process. We talked about this. We're going to identify what needs are needed. We establish our goals. We take educational methods, implement the plan, and then evaluate. Some skills of an effective educator is we're going to make sure we're getting the attention of our audience, inform the learner of what are we going to learn. So you start and say, today, what I'm going to go over with you is X, Y, and Z. And then you say, we're going to stimulate recall of prior learning. So tell me what you know about. Then we present the material and we provide guidance. We ask for their feedback. And we assess performance. A big thing in your textbook is teach back method. That's when you teach somebody a skill or an idea, and then you have them teach it back to you. So it's a really good way to see have they understood the concepts. That's going to take us to education into motivational interviewing. And what this helps you do is figure out what does the patient know and what are we going to do with our information, and are they going to want to change based on what we're teaching them? We have our 4 steps: engaging, which is going to be making sure it's patient-centered; empathetic listening; guiding, which includes a particular identified target that we're going to look at for changing; and evoking the client's motivation. Okay. When we look at developing effective health education programs, we're going to send a clear message to our learners. This is what we're learning, and this is what we're going to do today. We're going to select the most appropriate learning format. There's many different ways you can present. You can do hands-on, you can do verbal, you can do drawings, you can do music, all different kinds of things. We're going to create the best possible learning environment. And what that is make sure they're comfortable where they are in where they are learning, and that they are in a nice comfortable chair and they're ready to learn and they're in a good place in their head. We're going to organize positive and meaningful learning experiences, make sure we have that participation and then that evaluation at the end. One thing that I wanted to talk about as well is be real age specific when you're teaching something. So with younger children, you're going to use more concrete examples. So you might tell 3-year-olds to brush their teeth 2 times a day. But for 10-year-olds, you can say, hey, listen, you brush your teeth so that you don't get cavities. And if you don't brush them, if you don't brush them, you get cavities. If you brush them and make sure you're flossing, you can do that a little more. When we're looking at objects or devices, we want to make sure that we increase attention. So if I can demonstrate with an actual item, that's usually easier. So the example I give you is children with asthma, when we hand out inhalers and we actually have them do the actual activity rather than giving them a handout. Incorporating repetitive health behaviors into games will also help kids retain knowledge and acquire skills. So learning to cook healthier foods is more learned if you allow the patients to taste the food, to make the food, to taste the food, and then discuss how the health has changes. When we looked at our educational issues, I want you to really consider age, culture, and ethnicity. We're going to talk about technology a little bit and where that plays into age, but culture also knows, like we said in the beginning, sometimes some cultures will value different types of education. And ethnicity, we're looking at are pretty much like with our culture. What have they experienced in the past? What's their experience? What do they believe in? We see these barriers to learning, and these are educator-based barriers. And this means you as the nurse, maybe you're afraid to maybe you're afraid to speak. Maybe you feel like you don't have enough experience with the topic, lack of knowledge about getting actively involved. Sometimes uncomfortable when you're asked questions, not prepared for the use of media equipment. We've had this problem in our class. Sometimes my computer doesn't cooperate, or I don't share the screen as well as I'd like to. Now we look at barriers to learning, and these are the learning ones from the learner perspective. So low literacy is a big one. So you have to really be sensitive. Just because you're meeting with adult clients doesn't mean that they have graduated from high school or even graduated from middle school. I have a family that I work with, and mom's on a 3rd grade reading level. So you have to really be sensitive to that. Low literacy is going to have more difficulty with your health literacy because it's a little more advanced reading. Could be also that they have a lack of motivation to learn. Maybe they don't really care. Why am I doing this? Can I do this? Should I do this? That kind of thing. When we look at a 15-year study, we found these kind of impacts on our barriers. So young adults, high levels of education, we're going to have internet use good. They like it, they'll use it, they feel engaged with it. We see older adults have a harder time with the internet. We're finding about 85% are going to use the internet. We look at class differences like we spoke of. People with college educations are more likely to use the internet than those with a high school diploma. And then racial and ethnic. So at present, and this was when our book was published, so 2018, 78% of Black, 81% of Hispanics, 85% of whites, and 97% of English-speaking Asian Americans are internet users. So look at that. I mean, we have more than 3/4 of all of our different racial and ethnic differences there using the internet. And also people who lived in rural areas because they're further out, things like that, it's going to be 78% are going to be using the internet. So when we look at technology, we're going to look at computer games, videos, CDs. Sometimes technologies can let them be engaged, provide feedback. It's more consistent to how the learner likes to use the information. When we're looking at quality of internet health information, we spoke about this in class previously. You really want to look at like the content and credibility. Are you getting the information from Googling it? Probably not as credible as if you were getting it from an established website, such like a nursing journal or something like that. We look at the design and interactivity and links that we can click on that may take them to better sites or to worse sites. So when we're evaluating, it's a systematic and logical way to make decisions to improve. So we're going to evaluate the educator. We're going to look at the process, evaluate the product, and evaluate health and behavioral changes that we see. So our long-term evaluation. And we're going to work effectively when we're doing group teaching, right? Groups can be used to make changes for individuals, families, organizations, and the community. When we look at our communities, we're going to have those collective interests, a link between the individual and our larger group. Groups can bring about change to improve the health and well-being of individuals. And through community groups, nurses can help people identify health needs and make some changes. So when we look at our group concepts, it's usually a good way to initiate and implement change, like we said. We have to look at how is the group interacting? What's their purpose? Are they cohesive? Are they focused when they're together as a group? What's the culture? Where's the leadership? And what's the structure? The way we can really help to promote health through group education is to have groups that will support an individual's health change and exclude those that are unable or unavailable because of social or emotional isolation. So if somebody doesn't enjoy working with other people, they don't want to be working in groups, probably group education is not going to be good for them. We're going to be looking at conflict strategies for change and evaluation of group processes. So that takes us to the end of our PowerPoint. I wanted to show you some of the things out of our textbook that we're going to take a look at for this week. And I'll pull that up in just a moment. Oops. Sorry, guys, I'm sharing the wrong thing again. All right, and here we're going to take a look at our things that we looked at, use of technology in healthcare. I wanted to draw your attention to our Healthy People 2020 and primary, secondary, and tertiary focus that we looked at in this chapter. And if you did your reading, here we go. Oops. Here we look at our Healthy People 2020, and we're going to be educating here. So our primary prevention is going to be educating at health fairs regarding immunizations for children, older people, and those with chronic illnesses, right? Because we're educating, it's before we have a problem. So here we're going to look at secondary. We're going to educate at health fairs with those that already have something, along with health screenings to make sure that our duration and severity is less. And then when we're going to tertiary education, we're going to educate in rehab centers or adult daycare centers who have had a stroke. So this is where we're going to do our treatment there. I like to show you that because that's a good one that usually pops up. That's about it from the textbook that I wanted to share on teaching and education. Like I said, I'm going to have you guys watch a video on Bloom's taxonomy, which is going to be cognitive, your cognitive domain of thinking. And going to do a little bit on chapter 12, not a ton though. So let me just pull up chapter 12 for us. And I'm going to cover some of it. And what I don't cover, I will tell you, I will cover next week, because it's going to be really about community. And I think one of the nice things about community is that we can take a look at how we define it. We've talked about this several times, and what we can do with each and every community. So let me just get our PowerPoint here. At the end of our lecture too, I'm going to make sure that I go over with us what's due this week. Your group assignment, you guys should be on that. And that should be a good one. That if you have any problems, you guys have been in good contact with me, so I appreciate that. All right, let's look at our chapter 12 is going to be our community assessment and evaluation. We're going to look at, is our nursing practice community oriented? We're going to look at community oriented nursing practice, the not nursing process, and which methods of assessment are most appropriate in different situations, and develop a community oriented nursing care plan. So when we look at this, we're going to look at different concepts and guidelines with our community client. We talked about community. It can really be people and relationships that develop. It can be geographical, it could be time, it could be what are they doing, what are their activities, what are our community residents. When we look at community as a client, it's saying that the practice is oriented toward the community client, and community as a client requires that the health of the community is the overall goal of our nursing plan. We then have community as client and partner in nursing practice, direct clinical care, and part of a population-focused health practice. We take a look at that. Our goals of community-oriented practice, we're going to have the nurse and community work together. 3 common characteristics: our status, our structure, and our process. So our status is going to involve physical, morbidity and mortality rates, emotional, client satisfaction, and social components like crime rates. Okay, our structure is going to be our services and resources, and our process is going to be our effective community functioning or problem solving. So when we look at our goals and means of community-oriented practice, we look at Healthy People 2020. We know that this offers a vision for the future for healthy communities, specific objectives that are going to follow that. recognizes the need to work collectively in community partnerships. So that's an important part here. We have multiple organizations that work together. All of these are going to be your guidelines that are going to work to focus our community-oriented nursing practice. So I'm going to stop right there at this point, and I'm going to, we'll finish up chapter 12 next week because I want to do a little more interactive with you guys. This is a pretty interesting topic. What we're going to do right now is take a look at our syllabus for the week and see what we have working and what we're doing. Okay, where are we? Okay, so here's our syllabus. Oops. All right, because we had the exam though, we're going to split 11 and 12 together so that, split up 11 and 12 just a tad bit so that you guys have some more interactive learning when we do this. So we're going on here. Oops. We're here at week 6. So we're doing 11 and 12. We have a discussion question 3 that was this week, and attestation and questions, which I gave you guys an extension on. And we will look at what we have going on our modules. No, next week, you guys have that infectious disease project that's going to be due. And then remember, we have our vulnerable populations. It's coming in week 9. You guys should be working on that. I'm going to also send you a link I would like you to watch that will help you in your development of this vulnerable populations. It's a windshield survey that Professor Apple did, and she went to Hawaii and did a windshield survey, and that'll help you see what we're really looking for in that project. So for this week, I expected you to do 11 and 12 for your reading, and that should be about it. If you have any other questions, look ahead for next week. Group project will be due Wednesday of next week. And any questions, what I would ask is that you contact me. Otherwise, have a great week. Make sure you do your reading for next week, and we will touch base Tuesday. Take care.